Hi friends, in this topic of ECG basics, today I will talk about ECG changes in biatrial enlargement. First is the disclaimer. Caring Doc's YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to biatrial enlargement. The biatrial enlargement is diagnosed when criteria for both right and left atrial enlargements are present in the same ECG. The diagnosis of biatrial enlargement requires the criteria for left atrial enlargement and right atrial enlargement. They are to be met in either lead 2, lead V1 or combination of both the leads. ECG criteria for biatrial enlargement is the spectrum of P wave changes in lead 2 and V1 with right, left and biatrial enlargement is summarized below. In lead 2, we will get Bifid P wave with amplitude more than 2.5 mm and duration of P wave more than equal to 120 milliseconds. In V1 V2 we will get biphasic P wave with initial positive deflection of more than equal to 1.5 mm tall and terminal negative deflection more than equal to 1 mm deep and terminal negative deflection of more than equal to 40 milliseconds duration. Or we can get combination criteria as P wave positive deflection more than equal to 1.5 mm in lead V1 or V2 and notched P wave with duration of more than 120 milliseconds in both leads V5 or V6. So these are the P wave changes in biatrial enlargement. The causes of biatrial enlargements are combination of both left and right atrial enlargement. For example, right atrial enlargement is seen in pulmonary hypertension due to chronic lung diseases, tricuspid stenosis, congenital heart disease like pulmonary stenosis, tetralogy of Fallot, primary pulmonary hypertension, and left atrial enlargement is seen in mitral valve disease, aortic valve disease, hypertension, aortic stenosis, mitral incompetence, hypertrophic cardiomyopathy. Let's take few examples. In this ECG, we can see in lead 2 there are Bifid P wave with amplitude more than 2.5 mm and duration more than 120 milliseconds. P waves have a positive deflection of more than equal to 1.5 mm in lead V2 and in lead V5 V6 notched P wave with duration more than 120 milliseconds in limb leads. Here we can see this is another example of biatrial enlargement due to idiopathic cardiomyopathy. Here we can see biphasic P wave in V1 with very tall positive deflection, almost 3 mm in height, and a negative deflection that is both deep and wide. I am zooming it. In this ECG, P wave will lead to a tall more than 2.5 mm and wide more than 120 milliseconds. P wave in V2 are tall more than 1.5 mm while the terminal negative portion of V1 is deep more than 1 mm and wide more than 40 milliseconds. You can easily appreciate P wave in V2 are quite tall, amplitude is high, while the terminal negative portion of V1 is deep more than 1 mm and wide more than 40 milliseconds. You can zoom it and see. Voltaire has said the art of medicine consists of amusing the patient while nature cures the disease. With this, I conclude my today's topic. Thank you. Keep learning.